And hey everyone, just note as you're coming on, you are automatically on mute, but feel free to show yourselves if you're comfortable and at least put your names on so we can see who's coming in.
Hi, how are you?
Good, how are you?
Good, good. I'm Melissa. I'm the office manager for United Fidelity Bank.
Oh, awesome. Thanks for joining, Melissa.
You're very welcome. My pleasure.
And thanks for sponsoring. We'll definitely be
Yes.
giving a great shout out.
Very good. Well, thank you. Appreciate that. How's your day going?
It's great so far.
Good, good.
How about you?
It's kind of just not a whole lot going on this morning, so which is good. Sometimes we need those to ease into the end of the week. So
Definitely.
yeah. Very good.
All right, everyone, we are at 12:01. I'm going to give one more minute because we've had over 100 people register, so I see lots of people still coming on. But know that we only have an hour together and a lot to get through, and I definitely want Iain to have some time, some really good time. So we'll give it until 12:02 and then we'll kick it off. While you're getting set up, I might recommend that you, up in the upper right hand of your screen, hit speaker view once we get started, and it will feel a little more intimate as though, you know, Iain is speaking to you. But if you want to see everyone's faces in gallery view, that's definitely your preference, whatever your preference. All right. So let's do it. We are at 12:02. I want to welcome everyone today. I'm Chelsea Herring-Cozy. I'm the Executive Director with the Coalition for Homelessness Intervention and Prevention, or as most of you know, CHIP. Like so many of you, we are reimagining a lot of things this year, including our annual celebration event. So this year we are reimagining how we're engaging and have really landed on a series of lunch and learns that we'll be offering over the next 3 months on key topics related to the intersectionality of homelessness, public health, race, and youth. So hopefully you can join us for the entire series. We will have a culminating event in December as we recognize and celebrate community partners, advocates, and providers. So hoping you can also join us in December for that celebration. Today kicks off our first event in the series, and we are so excited to see all of you and to have you join us for this. While this is a free event and series of events, if you do feel compelled to donate, please check us out online at chipindy.org. For those of you who have already, we thank you very much for your continued support. And we want to thank a few of our sponsors today, including one of this year's event sponsors, DOZ Foundation, and today's supporting sponsors, United Fidelity Bank and Citizens Energy. Thank you so much for your sponsorship. We'd also like to give a special thank you to Iain, our featured speaker today, who you will get to hear from and see shortly. Who has asked us to donate his honorarium back to the community and in a way that shows appreciation to direct service providers in the homeless sector. So stay tuned. In the next week, we'll be sending out details to all of you about what that will entail. So Iain, thanks so much. And we'll definitely let you know how that plays out and send pictures. Couple quick housekeeping notes for our virtual environment. Everyone is on mute, and we ask that you remain on mute just to reduce any kind of background noise or static. Please utilize the chat box for any comments or questions. We'll be tracking that, and we can capture that at the end of today's session. We are recording, so it will be available if you want to go back and watch it all. And then again, if you want to change to speaker view, you're able to do that up in the right-hand corner. So let's get to today's topic. Today's topic is about the importance of housing as a public health response and how this public health crisis has really put the issue of homelessness into perspective. Simply stated, homelessness is incompatible with health. As our community has responded to this crisis, or as Professor Margot Kuschel says, the enormous public health crisis that has been superimposed on the existing housing crisis, it's really challenged us all to re-examine, rethink, and reimagine our systems of care and services. We are thrilled to have Iain Jong here with us today to really help us frame this discussion and to dig deeper into the issue of housing as a public health response and how we really rethink our systems to better serve people and to recognize the importance of housing. So with that, I'm going to introduce Iain and turn it over because he's really who you're all here to hear. So I've had the opportunity to see Iain speak at a few conferences, and he's phenomenal. I leave every time super motivated and inspired and asking lots of new critical questions. Not only did Iain write the book on ending homelessness, and if anyone wants a copy, I would encourage you to get one. We're passing ours around the office right now. He's committed to working closely with communities to make the necessary changes to actually achieve this. And he's doing that through his work as president and CEO of OrdCode and his connection across the country and actually across the world to really help communities rethink systems. Iain is considered a positive disruptor who changes the way we think about and respond to homelessness. He is a fierce advocate who brings his unique style, humor, and authentic self to everything he does. I have no doubt you will leave today feeling challenged, motivated, and eager to create lasting change that better serves people. Iain, anything you want to add to that intro?
Oh, I think most intros make me feel a little blushy, and that one does too. So I think I'm in a good space. We can say no more about me right now, and that'd be good.
Okay, well then let's hear from you. So let's start off with a little bit of framing, Iain, and then we're going to get into a moderated discussion. So COVID-19, we're in the midst of this public health crisis, and you talk a lot about and write a lot about creative destruction and disruption. And sometimes it takes some kind of destruction or disruption to really challenge our orientation and the way we think about our systems. Can you talk a little bit about COVID-19 and whether or not COVID-19 can be seen as a catalyst for that kind of disruption or destruction that is going to force communities to really change the way in which they deliver services and provide systems of care?
So I think about COVID as a stimulation, a jolt, a recognition that we were doing some really good things in many different areas within our system, but the necessity to accelerate change in some other areas. And a large part of that is obviously related to understanding the health impacts of COVID. And how do we make sure people experiencing homelessness are safe? But I think what it's also done is said, look, homelessness is an intersecting crisis, right? And the three primary ones that is really exposed for me is we have a homelessness or housing crisis. We have this pandemic thing happening, and we have an opioid crisis all happening at the exact same time. Those are the ones from the kind of more clinical public health perspective that we could say are intersecting. But I think we can layer other intersecting realities in there that COVID has also shone a light on in some communities and more favorably in others. So things like systemic racism being alive and well in some communities, and our systems of care not being really well designed or inclusive for people of color. We see systems of care where homophobia and transphobia is alive and well, and so are some of the individuals that are most disadvantaged in accessing resources. We see the impacts of justice or lack thereof impacting people's lives and the experience of incarceration. And so what it's really kind of shown us is we have a strong tendency to pathologize people into these categories of crises rather than actually leveraging the humanity of each person to be the best version of themselves or their family and achieving housing. And so the disruptive part is essentially said, look, if you have parts of your system that are not accessible to people who are remarkably vulnerable, especially populations that are disproportionately impacted by COVID, then that is the opportunity, not for us to get down on ourselves, but our opportunity to say, what's next? And to stop saying, to the people that we serve, reframing our orientation from what's wrong with you to what happened to you, and really entering into that space, because COVID has created an environment where some of the individuals or families that we would have wanted to serve historically, we now need to serve, even though they have complexities that might see as surpassing our system of care. The last thing I'll say on this one is this idea of creative destruction or passionate disruption. I'll call it different things. Sometimes the best thing that happens is a forest fire. And controlled burns, I'm not talking about the sort of thing happening on the West Coast, but this idea that rejuvenation and renewal comes from releasing the energy of that which is already there. And I think one of the lasting impacts of COVID will be there's a number of organizations and entities that exist in our community that are now unlocking their potential in a different way. It's not that they couldn't do it historically, it's that they've been given permission to enter into a space of innovation and to actually think critically around not just what do I do to meet my contract or my funding requirements, what do I do to actually make a lasting change?
Mm-hmm. Yeah, thank you for that, Iain. I think that's a really kind of interesting way to think about it. So let's dig a little deeper into what that looks like, as we really look at how we have historically operated, and this notion that we have to work differently. Our system has to function differently. We can't go back to kind of pre-COVID and this health crisis. And so what are we learning from this? And what is that going to prompt us to do? So let's talk a little bit about shelter models. COVID-19 has made us all pretty acutely aware of the challenges of congregate sheltering and congregate shelter models, and the reality of overcrowded, overburdened emergency shelters. How has this public health crisis really changed or reinforced the way in which shelters function within the homeless response system?
I think what it's really done with the shelter system is said, well, let me back up for a second. In communities that were already focused on ensuring that their shelter was really about ending homelessness and not manufacturing or sustaining homelessness, COVID didn't really have an impact on them other than perhaps increasing the urgency with which they operate. But for shelters that may have struggled in that space of truly being housing focused, and when I say housing focused, I'm not talking about do you have like a housing worker or two that comes into your place or are people on coordinated entry. I'm talking about an unequivocal embracing that shelter is a process, it is not a destination. That we need to stop thinking about shelters as places of rehabilitation. They're not places to heal or fix people. They're not places to get people ready for housing. They are emergency accommodation that should be unrelenting in its focus of getting every single youth, individual, adult, and family out of shelter and back into a positive, safe, appropriate place as quickly as possible. So if we think about it, this notion of process rather than destination, what do we see across the country in my work in this COVID environment? Is it communities that have been very program centric in their shelters are failing miserably. And they're failing miserably because they have historically been a destination, not a process. And as a destination, I will say that a lot of shelters throughout the country have committed the most heinous of crimes in sheltering, which is they become places of therapeutic incarceration, right? I just need you to stay here a little bit longer and a little bit longer and get a little bit better, and then you'll get back on your feet and then get out, as opposed to a shelter model that says, the primary function of me working in a shelter is to leverage the resiliency within you to help you achieve housing. Housing is good healthcare. Housing is the only known cure to homelessness. So if we're not focused on housing and shelters, what the heck are we doing? And so COVID, I think when we looked from saying like we were overcrowded to now we need to get like motel spaces, and other communities had like convention centers rehabilitated, and other communities are starting to look at sprung structures and those sorts of things. That will only be as good as the transition in the modeling of shelter that co-occurs with it. So that's point number 1 or 2 or 7. I want to make one more point on this one, which is, dang it, hold on, caffeine.
Yeah.
Which is, if we want to be in the space where we realize that COVID has actually been a positive disruptor in shelters, then let us disrupt the notion that there should be barriers to shelter. Let us disrupt any thinking that says you have to change who you are before I give you what you need. And the analogy that I use, it's a health analogy, and I'll run through it just really quickly for everybody who's here today. If any of you had a heart attack and you got rushed to the hospital, we wouldn't make you step on a scale first. We wouldn't say, oh, I'm sorry, Iain, you're 30 pounds overweight. Lose those 30 pounds, then we'll help you with a heart attack. We wouldn't do it, right? If I was a smoker, they wouldn't say to me, well, prove to us you've been smoke-free for 90 days, then we'll help you with your heart attack. If I cussed out the doctors and dropped some F-bombs because of the pain in my chest, they're not going to say, oh, get out of here. If I once killed another person and I've served my time, they're not going to say, you know, eye for an eye. If it was my 4th heart attack, they'd still help me. In other words, we have to start saying, change who you are so I can give you what you need, and instead start to embrace a culture that says, you are who you are, and I will give you what you need.
Yeah. Yeah. So again, it's that not just shifting of practices, but really shifting of mindsets.
Right. The orientation, the way that we think about the people, you know, is it our privilege to serve people experiencing homelessness, or is it their privilege to be served by us? It better as heck be our privilege.
Yeah, absolutely. Absolutely. So again, we're a community that's really, you know, asking these questions and looking at, you know, how we have operated and what we are really becoming more aware of in this public health crisis, and the health crisis being the lens that's really focusing, you know, focusing our vision and giving some clarity. And so I think we're starting to really flag some of these things. We need to think differently and work differently to better serve people and to have the privilege to do that. But part of that is we don't need to reinvent the wheel either, right? So we know that our communities that are doing this and that have been doing this. So you do a lot of work across the country, across the world. You see communities that are really embracing and adopting different practices and approaches. Mm-hmm. And as you said, COVID-19 is really impacting this, so many of the ways in which we work, and for communities maybe that haven't gone through as much of a transformation, this is becoming that catalyst. So what are you seeing in the way communities are adapting to really address homelessness in this public health crisis that's encouraging to you, that's giving you some hope that this can be that kind of catalyst or disruptor that's going to have really positive impact on people? And then the flip side, what have you seen that's been problematic? That's
how long do we
got? Yeah.
Okay. So let's start with positives, because that's more uplifting. And I want to focus on 2. So one is, I've seen not just shelters, but entire systems of care start to focus more time and energy on diversion rather than homelessness response in the kind of more traditional sense. So rather than saying we're going to wait for this individual or family to enter into homelessness, then we're going to try to wrap supports around them, and then they're going to get to a place where they're out of here, really kind of embracing this notion of progressive engagement, but also very intensive engagement at the front door of our systems of care. And I think about a place called Grace Marketplace, Gainesville, Florida, a community where they say, look, we got no affordable housing, we're a college town. You know, people, when we first started working with them, they have to live in our shelters for years because there is no space that's affordable for people to go. And they've come a long way in a whole bunch of different ways of thinking and doing. But let me say this, since the pandemic started, they realized they needed to double their efforts on diversion. They have maintained greater than a 40% diversion rate since the pandemic began. Unsustaining, or it's completely sustaining, unwavering. And they continue to enter into the space of saying, now that we know what we're doing, how do we get better and better? And realizing it's not just about using a tool. It's not about just having a formula of questions to ask. It's actually embracing the entire spirit of the intention of resiliency. That if I am in a space journeying with an individual that is experiencing homelessness, yeah, I can accept that there's an emotional toll. People are overwhelmed, they're angry, they're sad, they're confused, they have angst, trauma. I can appreciate all that, and I can enter a space to make sure that this doesn't make any of those things worse. And that's really what diversion is all about, right? It's not about saying no to people. It's about saying, yes, I see you. Yes, I hear you. Yes, I will respond to you. And if we can keep you out of shelter, all the better, especially with COVID going on. So I'd see that as a positive. The other positive that I point to is an complete commitment of pedal to the metal housing during COVID. So I think most organizations had this period, March to mid-April, some a little bit longer than that. It was like, we can't house anybody because we can't have people in the community because, like landlords don't want to meet with us and, those sorts of things. So whoever we have in shelter or our surge capacity facilities, we're just with, right? There's no getting around that. But I look at some of the organizations that have said, I don't accept that paradigm. I think we need a new paradigm, which is how do we house people faster in COVID, as opposed to how do we do business as usual in COVID? One of the shelters we've had the privilege of working with, it's in Calgary, Alberta, Western Canada. Second largest shelter in North America is in fact in Calgary. And, so they're unrelenting focus on housing people and actually accelerating housing during COVID has resulted in over 250 people getting access to housing out of one shelter since the beginning of the pandemic. In a market that isn't affordable, where assistance rates don't keep pace with the cost of housing. God bless my country people. If you didn't figure out, I'm Canadian, by the way, out about but the western part of the country, that's very conservative, right? It's not the sort of hotbed liberalism, anything goes. It really is. They have the support of the community because not only are they ending homelessness, they're saving money. They're saving lives and saving money. And that's just such a phenomenal combination to make everlasting change happen. So I think we've seen that. Positives. Those are the two positives. And then I was, flippantly saying, like, how long do we have on the negatives? And I don't want to dwell too much on the negatives. So let me focus on two there as well. One is, instead of lowering barriers, we've seen some facilities actually make more barriers for access to services. So things like, if we only have X number of beds, I would say, so this is like an Iain argument, I would say, you should really make sure those beds are going to the most vulnerable people in your community, right? You should go make sure those beds go to the people that, if not for you, they would have no friends, no family, no safe and appropriate place that they could go. Like, you really got to think critically around who comes in, and we should embrace the fact that we are called to serve the most vulnerable amongst us. But in some communities, they've gone the opposite direction. And they've said, like, look, we want the people that we think are going to be able to comply with physical distancing and mask requirements and, won't give staff a hard time. We need people who will know how to, like, self-isolate or stay in quarantine kind of sections of shelter. So we don't want anybody who uses drugs, and we don't want anybody who smokes, and we don't want anybody who drinks. Or you start to see other people as like, well, how, there's conversations around housing readiness, as opposed to looking what I always say are the two core criteria for being ready for housing are you're homeless and you're breathing. And if you meet those criteria, you're good to go. They've really started to say, actually, it's got to be more than that. We want to get people to a place where we think they'll be successful. So I see that as like the increase in barriers as being a huge drawback. Mm-hmm. Second huge barrier that I'm spending a lot of time on throughout the United States and Canada and Australia these days is the increase or rise of more encampments in the COVID reality. And the reason why I see it as a negative isn't just the fact that there's encampments. It's that most communities that we're engaging with have never had street outreach workers trained on how to house people directly from living outside. So they're looking at this as an emergency response, a sustaining or managing homelessness response, rather than an opportunity for ending homelessness response. And if you reconfigure your system that really says street outreach is actually a function of mobile housing navigation, it's not about soup, soap, and salvation. It's about unrelenting focus on getting people out of homelessness into housing. We can do early detection of encampments. We can help them wind down through voluntary closure when people move into housing. But in the communities that aren't doing that, they're number of people living outside, it isn't just, you know, scattered dude here and dudette over there, and it's large concentrations of people that are engaged with each other, which is having political backlash, which is having issues with law enforcement and abatement and bylaw officials. And you kind of go through the list and say, this is a hornet's nest we didn't need to have if your system was actually designed to do early detection and actually resolution directly from the street.
Mm-hmm. So let's talk a little bit more about that and those living unsheltered. I mean, we focused, and I'm going to guess Indy's not unique in the sense when the pandemic hit, our immediate focus became on shelters, congregate shelters. We've got to reduce shelter populations. We've got to get more people out of out of congregate settings. And there was, you know, a little bit of push of, but what about people living unsheltered? We have people living outside right now. There's been a lot of focus across the country on shelters, but what about those living unsheltered? How has this public health crisis really impacted unsheltered homelessness and challenged the way in which we do street outreach and the way street outreach is operating?
Yeah, so for some communities, this is good to great. Obviously, I haven't done a whole lot of analysis on the delivery of street outreach services in Indy. So I'm speaking from a place of naivete. But I will say that the lessons learned seem to be, you want your outreach to be impactful, and you want to make sure in the sort of training and writing and stuff that I do on street outreach to say, once upon a time, we charged you as an outreach worker with the responsibility of building rapport and trying to navigate to emergency services. That's all we asked of people. And that's also what we funded street outreach to do. I've said repeatedly through this time that what we've learned about street outreach is essentially, especially when there is this groundswell of negative response to the seemingly increase of people living outside, is we got to stop going to McDonald's to order lasagna. Like, we got to stop asking street outreach workers to do something that they're not paid to do really well. They're not, in some instances, not qualified to do. They haven't been trained to do, and expecting that they can just flip a switch and change their business model. That's not the way that this is going to be effective. So in the rise of unsheltered homelessness and or the response to unsheltered homelessness, like when you brought up, yes, that's great for shelters, what about the people who are already outside? I will say we need to stop looking at this as Band-Aid solutions and start thinking about not how many people can I see in street outreach in a shift, but how many people's homelessness can I end through a much more intensive response. So this idea of working with a large group of people peripherally, which is the traditional street outreach model, to say, no, I actually need to work with a small group of people intensely, not a large group of people peripherally. I don't need to have 100 contacts in my shift. I need to have 8. I don't need to have seen every single encampment and every single location across an entire, large urban area. What I need to do is focus on areas that are known to have people that are really vulnerable that are living within them. And people will then say, well, what about the others? And I'll say, fantastic, invest in more. But if you ask me to do everything, it's like asking, the fine folks at the hospital to be able to, there's a reason why we flatten the curve, right? I mean, we flatten the curve to not overwhelm the shelters or not overwhelm the hospital system. There's a reason why we need to work really intensely with a small group of people in street outreach so as to not overwhelm the system of care. We need to be much more thoughtful in this space. The last thing I'll say about outreach and the rise of encampments and whether or not they've been left behind is it's a positive but sometimes depressing lesson learned is a lot of street outreach in this time and space has benefited from learning to shut up and listen. Listen to the people that you're engaged with rather than going out to sell a program. Because program salespersonship is only going to find a limited customer base, as opposed to a thoughtful integration of an ideological approach that actually informs our ethics and our principles and our values and our mission, that says, like, I'm not out here to be doing conversion to our way of thinking. I'm out here to offer a housing solution. And if I am, trained and knowledgeable about housing solutions, and in particular understand how do almost every other person in your community who's economically poor, how do almost all those people find housing all the time and never experience homelessness? That's the magic I need to leverage.
Mm-hmm. Yep. Yep.
I was kind of rambling there. I get all excited. What's the next question? This is good.
So again, keeping in line with COVID-19 being really used as this catalyst and this lens in which we're able to re-examine some of this. I think, the message we keep talking about and hearing is a lot of these issues existed before COVID, and COVID is just bringing them to light, maybe to a broader audience, or are really just exacerbating some things that already existed. So when we talk about the intersection of health and homelessness, we knew before COVID, those that are living unhoused already had higher prevalence of chronic illness and disease and harder time accessing healthcare. COVID has just exacerbated that. I mean, talk about a lot of healthcare move to telehealth. How does that work when you're living unhoused and may not have access to that technology? And communities have tried to adjust to that. So can you talk a little bit about what you've seen in your work across the country with this intersection of health and homelessness and the changes that COVID has prompted to really better understand the kind of health conditions of those living unhoused and the way in which those living unhoused are able to access health services and where we have to make some major changes?
Yeah. I think this is the toughest question so far. Housing is good healthcare, full stop. Health often has conversations about, prevention, and has conversations about maintenance, and has conversations about intervention. I mean, that's the way that we think about healthcare. And I think that our system response in the space of responding to homelessness in this time has to be thinking through the same sort of steps, right? What's the preventive pieces we could be doing right now? So how do we make sure that other people aren't entering into homelessness that don't need to enter into homelessness? And I talked a little bit about that with diversion earlier. But there is the space of kind of mitigation in between. In that space, from a health perspective, we see, for example, that if you look at the data analyzed by the California Policy Lab from across the country, about 50% of the population that's unsheltered, and this is pre-COVID, is trimorbid. So it has a mental health issue, a substance use issue, or chronic disease all co-occurring in the same person at the same time. That is staggering. Homelessness already was, especially unsheltered homelessness, so not exclusively unsheltered homelessness, already was a public health crisis. Mm-hmm. So when you say like COVID has put a light on it, I'll say yes, and the and part is, and what are we going to do? Right now that it is shining the light on it, do we just make excuses, or do we say, okay, no, if housing is good healthcare, and if the only known cure to homelessness is housing, because that's the other thing we look for in medicine, right? Is what's the cure? If we can have a cure, we want a cure. Then is our system of support actually designed to achieve those objectives, yes or no? And I think when COVID has led to some communities to realize is that everybody was doing their best with the resources they had for as long as they could prior to this coming out. And we might need to change the way that we do that investment moving forward if we want to have a legacy impact of our response in the COVID era. So I'm seeing a lot more conversations about this idea of what we really need to do is invest in change and spend on impact, right? So we really need to look at the landscape in this COVID reality and say, like, does it make sense for us to be funding, this many day services or drop-in programs? Like, probably some make sense. Is it the right volume under the right conditions? Maybe, maybe not. You have to be quite analytical in the community sense to understand. Shelter, do we have the right volume of shelter for the populations that we serve with the lowest amount of barriers that's going to allow people to achieve success? Do we have street outreach programs, as I talked about, being impactful? But then we also think about, access to other resources and the navigation. So when you talk about like telemedicine really coming in, I'll say, okay, so what is this teaching us about the disconnects between healthcare and homelessness? So not just, healthcare disparities amongst people experiencing homelessness, but what are we going to do about it? And I would say in the space of intersecting realities, COVID has really taught us, or my experience in working with communities, is that if you actually have a solution-focused mindset to the work that you're doing, those communities are solving a bunch of these problems. They're absolutely redesigning their system at this time because there is never been a greater need to make that redesign happen. There are funders that are coming around the table that are, sometimes duking it out and say, yeah, that's been your pet program, but you know what? They suck, and they've always sucked. And the degree of their suckage has just been made more acute by the pandemic. And now we need to have a larger conversation around if that means we're going to lose X number of beds of capacity or X number of hours of street outreach services, how are we going to fill those holes? As opposed to the problem that we have in these responses is other communities that just focus on excuses. So they name the thing that is broken, but they don't name any options to go about fixing it. Or the communities that still confuse having a big heart with a big brain, right? That homelessness is a really weird industry in so much as we think if you care, you're qualified. And that's just simply not going to cut it in the redesign of programs as things like health and homelessness integration have been made much more the spotlight and the focus. So I think we can do a lot better in that space. I also think there needs to be a call to action from elected officials to get some of those different entities to start to speak to each other in different ways. Like I detour, but some of these temporary surge facilities for shelters, I was amazed in some communities, like the degree of addiction and treatment recovery and harm reduction resources that could get into some of those facilities so fast, and mental health clinicians, they were great at mobilizing those. And I was like, how come you never mobilized these people before? Well, they wouldn't come before. And then you talk to some of the practitioners who were doing it, it's like, well, we were never really asked in the right way. So we've had these divisions of conversation as a community around what does an actual community-based response to homelessness look like that's solution focused. And I think this is kind of giving us an opportunity to work on that.
Yeah, and we've definitely seen some of that here in Indy. I mean, we've had similar conversations in response to COVID of, wow, we were able to act really fast on this in this moment. How come we weren't able to do that before? And I think asking those questions becomes really critical, because why did it take a crisis to be able to say, this needs to happen now, it's urgent. It's always been urgent, but I think COVID is definitely at least pushing those questions a little bit harder, particularly across sectors, right? Like, how do we bridge across some of these systems, primarily when we talk about healthcare and homelessness. So, Iain, you wrote the book on ending homelessness.
Well, that is what it's called, yes.
And you offer pretty concrete ideas in your book about how communities can do that, can really achieve that. Has the formula, if you will, changed in the context of COVID-19? And are there elements that you see as becoming bigger priorities for communities kind of in the midst of this public health crisis?
So thanks for drawing attention to my book. It was a labor of love to take everything I'd learned over more than 20 years in the sector and try to put it into one place. And, from the political advice I've been asked to give very senior people in, large urban areas to the small nonprofit organization that's really struggling, and try to take all that and put it in one place. And I think I really have two takeaways. Just to put a bit of context for some other people, the book came out late last fall, and then, March hit and the world seemed to change. So some of the things that I put in there around some of the shelter operations, the reality is they just don't operate in that way anymore. But the bigger takeaways for me from the book are twofold. One, how do we accelerate change? And two, how do we bring change to scale? Mm-hmm. And those are the two things that I'd say the book didn't do a fantastic job on. The COVID reality has really focused, I think, a lot of my time and energy on. Like, it's not that the formula isn't right. It's that we need to resource the formula differently. We need to have different expectations of the formula. We need more people doing the formula. and we have to act with urgency, but not with haste. I think that are the biggest changes that I would make if I was asked to write like version 2, which I'm not going to do anytime soon. But I would say those are the big ones for me. The other thing that I think I might have highlighted a little bit more towards the end of the book, I really talk about dimensions of quality within a homeless service delivery system. And, it's not just the formulas of like how to do street outreach and how to do sheltering and how to do day services and those sorts of things, which are, a big chunk of the book is dedicated to those areas. But I would have put dimensions of quality a little bit more in the forefront so that we ask ourselves, not just, are we a busy system, but are we a good system? And what are the actual measures of goodness we want to look at? I mean, I don't just mean the numeric data. There's a place for that, obviously. But I mean, how do we know that we have good quality training programs? So like when a disaster like COVID hits, we don't have to worry about getting a whole bunch of people up to speed or being as many communities were perplexed when they started to do like different types of sheltering, especially when it was in different locations. And you'd have 3, 5, 10 different shelters who are involved in some of these, depending upon the location. You realize, wow, we all do sheltering very different from each other. Like, why do we each have our own standards and rules? Like, why don't we treat sheltering more like a franchise, right? Where we actually know the right things to do and we can then measure quality of whether or not those things are achieved. From funders' perspectives with things like street outreach, why do we do requests for proposals? It seems like a really dumb idea. We should do purchase services, not requests for proposals. Like we should be very clear as a community. We want X done in Y way for Z outcome and who wants to do it, as opposed to this more kind of open-ended dialogue around how would you do street outreach? We know the effective ways to do street outreach or sheltering or day services. And so I think I'd be a bit more prescriptive in the dimensions of quality in the book and the system management pieces in the book, the bringing to scale piece for sure, and the need to go faster, but not with haste.
Yeah. That's a good reminder. And, we're kind of in that exact place right now with all of the COVID money, CARES money coming to the community, orienting towards that surge mentality. But as you said, there's an urgency, but it has to be very intentional as well. And so I think that's an important reminder. So Iain, I have kind of one more question I want to throw at you, and then hope you're open to just taking some questions from the audience today. I've seen a couple come in chat. We've touched on a lot of different topics, and so I'm sure there are folks that would like to dig a little deeper in our last 10 minutes, if that's good.
Sure.
Okay. So just one of the last questions I want to throw out to you is for you to throw out questions to us. What are some of the questions or calls to action that you can leave us here in Indianapolis with today as we really continue to pursue our collective vision that everyone has the right to permanent housing and to be connected to care? What are the critical questions we should be asking? What are the calls to action we should be pursuing to really get to that place?
Do you as a community truly practice radical acceptance? Do you as a community know what it means to act with kindness? This idea of, lending another your strength as opposed to showcasing people's weaknesses. Do you measure what you do and refine based upon measurement? Mm-hmm. Do you have humility enough to admit when you're making mistakes? And that just because you might have spent a long time making that mistakes, in some instances in homeless services, decades, that doesn't mean we should keep it going. Are you as a community ready to speak truth to power? So if there is one or more organizations that really aren't effective, but are, loved by certain elected officials or always in the media, and they can tell a good story, are we collectively challenging some of those notions? Yeah, I mean, I'm just going to get on a soapbox for a moment here. Just one moment. One of my biggest frustrations in homeless programs and services is the sample size of one. we find one person, we ask that one person to tell their story, and we want the entire universe to believe that everybody who has an experience of homelessness is like that one person. And we don't pick a typical person. We pick the person who's actually most outside that curve, that if we were actually doing statistical analysis, we might classify them as an outlier and not include them in our data set. The person that didn't just exit homelessness, but they got a job that's paying like $45,000 a year, and they're going back to school at night, and they have visitation with their kids, and they're going to AA, and I was like, can we stop perpetuating a mythology of recovery and showcase what the more typical family or individual's existence looks like? Like, we're not an anti-poverty system. Most of the people we support are going to live in poverty for the rest of their lives. We're not an addiction recovery system. Most people we work with will have addiction or dependency for the rest of their lives. We're not a mental health recovery system. Most of the people we work with will continue to struggle with mental wellness for the rest of their lives. But no one's asking us to fix people. They're asking us to house people. So let's measure the right darn things, not through sample sizes of one, not through personal redemption stories, but whether or not we as a collective, as a system of care, have made the right investments in the right way, with the right organizations, for the right purpose, to achieve the right result.
Yes.
That's all I'm going to say about that.
I appreciate the soapbox and glad you went on it, because those are the questions I think we need to really be asking as a collective and a community, to really get at how we understand and respond to the privilege that we all have to do this work. So Iain, if you're good, we have about 15 minutes, and I would love for folks who have joined today to have an opportunity to ask some questions and maybe dig a little deeper on some of the things we've touched on. So why don't we start with the chat? Right now there's one question in the chat. If others have questions, please throw them in the chat. That's going to be the best way to manage this. So the first question is about staffing structure for shelters. What is the best staffing structure for shelters to really be able to focus on what's needed to get people housed? Beyond the operations, what should roles and responsibilities look like?
So if you work in a shelter, regardless of your position, you need to be knowledgeable and conversant in housing and be reinforcing that. So that's the first thing I'd say. So get out of housing as an expectation of title and into a mindset that housing is an expectation of all. Now, that doesn't mean everybody's a housing specialist. As we progressively engage, we start with a pretty intensive, somewhat minimal, at times even passive, but the intensive part is that I need staff to find guests in shelters to have the conversation about housing, rather than waiting for guests within shelters to come to staff to have the conversation of housing. So this being active, being proximate, delivering service in vivo, really important. The second thing is, assume that, especially if you're a 24/7 operation, assume that every single shift has a responsibility towards housing. And when people start to say, well, like night shift, like they're taking care of, people coming into the facility, and, they barely get any time until like 2 or 3 in the morning when it calms down. And then, like it's 5 o'clock and people are starting to rise and move around. I'm like, fantastic. You've got like an hour and a half. Like, let's stop having every person who's using the shelter have to look for their own housing, and said, well, I'm awake. I can get on Craigslist. I could have an entire stack of housing listings available for you by the time you wake up every single morning, right? So re-envisioning what some of these roles and responsibilities are, so that we can say, whether you're doing custodial work, food services work, intake work, you're like a floor staff person, you're a supervisor, that it all connects into housing. There's a great Salvation Army shelter in South Carolina. Deronda there says, if my staff aren't talking about housing, they're having the wrong conversation. And I've always loved that idea. You go to places like UMOM in Phoenix, and I mean, they've changed their staff uniforms. Their staff uniforms all just say, what's your housing plan? This idea that it's unrelenting in its messaging. Again, so that we don't get stuck into the pathologizing of people, and we actually counter those narratives when people say they can't, or what about this group? And I will say, yeah, there's going to be people with barriers. What are we doing to collectively solve it through the structures and expertise that exist within our organization? And if we are going to bring in external volunteers, let's make sure that they're also suitably trained and understand what we're trying to achieve. So that, we stop looking at sheltering as charitable do-gooding and start looking at shelter as the process by which people get housed again.
Yeah. Yeah. Other questions? We've got about 10 minutes. So you can do the chat, or we talked about a hand raise. You could do a hand raise feature. Iain mentioned a stick your tongue out feature.
Yeah. I could just come up, you could all put your cameras on. I could say a series of statements and you can decide if you love them or not, but I'd rather take questions.
Okay, we've got another question from Stephanie. As housing assistance tends to be donation driven, how do you frame housing needs without success stories? Considering people don't want to help others who don't try to help themselves.
Mm-hmm.
So I think you talked about, again, the stories, right? Those that can tell the good stories. And how do you tell stories, but in a way that kind of avoids what you mentioned is holding up the exception, the outlier as the story, but do it in a way that really does frame it to get people to understand and engage and invest. So if you could talk maybe a little bit about that.
If we feel it's really incumbent upon us to tell stories, then either an amalgam of stories or telling the story of the most typical person and not trying to hide behind that, right? And the hide behind it is I don't want to tell people the truth. Like I'm not trying to be, I'm trying to be on my best behavior today. To heck with that. Like maybe we need to tell the story that like, since we moved Iain into his apartment, like we're really proud of him when he stays there at least 4 nights out of 7. And, the fact that he has stopped performing sex work to get money for drugs has been a huge improvement, but a big struggle.
Mm-hmm.
And, the fact that he has gone from drinking mouthwash and, cough syrup to the point where he's now drinking beer has been a major achievement. Let's tell more of those stories, as opposed to the other kind of version that I put out there, which is much more dramatic and outside the norm. Let's be honest, like we're not here to save people, right? People save themselves once we give them housing. And that's like the story of the literature, like the peer-reviewed academic literature of housing first, right? Is that the real magic isn't everything we do before. The real magic is what happens after. We're the people that make after possible. So I want us to be in the place that, after doesn't have to mean perfection, and we have to let go of this quest for perfection. I'm a big Brene Brown fan. I don't know if anybody else is out there is a Brene Brown fan, but like, let's tell the story of enough. Mm-hmm. Instead of telling the story of these illusions of perfection. So I saw that. But this idea of like, because I get it, right? We don't want to help those who don't help themselves. And I'll say like, wow, we could totally feed into that methodology, or we could challenge that methodology. I mean, even within sectors in the field, you'll hear people say things like, well, I can't work harder than the people that I'm working with. And I'll say, yes, you can. Like, you get a paycheck. Like, you should work harder. We measure your success on how hard you work. Or, I could get them housed, but they would self-sabotage. No, they're acting exactly the way a person should act if they've experienced the sort of trauma that they've experienced. Like, anyway, what's the name of the book is the next question I see here. The book on ending homelessness.
Yes.
There it is. Can you speak on ending homelessness from those that are coming out of incarceration? Absolutely. The further we get upstream, if we know release dates, the more proactive work we can do. If we don't know release dates, if it is really like the Friday afternoon release, and be clear, if it's Friday afternoon release, it's probably going to be 3 or 4 o'clock in the afternoon with them just wearing their prison clothes and they're expected to be miracle workers. Then we have to start a process of engagement immediately that's focused on leveraging any natural supports they have first, even if they have quote unquote burned bridges with those natural supports. That part of the healing and recovery, if we truly believe that incarceration ends when you leave the walls of the prison as opposed to a continuation in society, then we need to model what that looks like. You're worthy, you're deserving, you've done your time, you know, it's over. And really get into the mindset that the whole point of this was supposed to be about rehabilitation, about reintegration. It wasn't supposed to be about punishment. Otherwise, we would call it the punishment system, not the correction system. How do we aggressively reroute the narrative around homelessness in our community? So I think on this one, a few things to do. One, use your data. And I don't mean that flippantly. I mean, like for every single program, know your mean, median, mode, and range. Know the diversity of experiences that exist within it. So you can tell the story that's driven by data, not by anecdote. Because as is famously said, the plural of anecdote is not data. In fact, it's anecdotes. If we want to aggressively reroute the conversation, the narrative around homelessness in our community, then I would say you need to be able to articulate a vision that people want to get behind. That your why has to become their why. You know, not to get like too Simon Sinek-y on this, but you know, this whole notion to like, it starts with why. That's where it starts with. If you don't want people to go off on tangents, then you actually have to have a shared responsibility of telling the same story. And you have to know that there's going to be different motivations in this field. If people align their motivations to assist with your motivation to end homelessness, then your community will radically transform. If we continue to have a bunch of different visions and different stories happening, then you'll be remarkably busy and you'll barely be effective.
Yep. So Iain, I don't see another question, so I'm going to maybe ask the last one.
Sure.
Just so we all leave really clear on kind of the challenge you've left us with. Radical acceptance. Yeah. You talked about, does your community practice radical acceptance? What does that mean? What does that look like?
I stand not in judgment of the people I have the privilege of serving. I accept the people that I have the privilege of serving. You know, from the heart attack example, you don't have to change who you are to get what you need. You are who you are and you get what you need. Which means that when we speak truth to power, it's like, you know, how do we reframe conversations about addiction and dependency within the homelessness response system? It has to come with an understanding of trauma and the impact that has on people's lives. Like if you work in this field and you haven't read, you know, In the Realm of Hungry Ghosts, I don't know how you could exist in judgment of people who use substances. I feel like I'm going through my bookcase here as we kind of go through. This was not staged. This is happening spontaneously. I think that radical acceptance means that I accept that every single person is housing ready, that they are worthy of housing. I don't say things like I'm setting them up for failure. I don't have like these preconceived notions. And when people fall out of housing, even after we house them, I don't have to, I really got to stop with this mindset of, you know, well, what's wrong with them or what did they do? And I have to start asking myself as the thoughtful, reflective practitioners in the space of radical acceptance, how did I contribute to this? What do I need to do better? Because if I don't get into a space of realizing that we will only succeed in ending homelessness if every single one of our talents are tapped into to the fullest potential, then we're going to have a whole bunch of one-offs of organizations, as I said, doing really good work, but probably not being as effective as they need to. If the most vulnerable person who's on your streets can't get into your shelters, that's a problem. If the most vulnerable person in your community can't get access to housing, that's a problem. If the most vulnerable person in your community can't be supported to stay housed, that's a problem. That's not on the most vulnerable person. That's on you.
Yeah. Well, Iain, we've got 1 minute. So I think we all want to take a minute to, if you guys can use your chat or your reactions to thank you. And thank you for spending your time with us today. Clap it out. For challenging us, for asking some critical questions that we as a community need to come together on. You quote in a book, and I was trying to find it really quickly, you quote in your book a quote from somebody else that the systems we have are set up to produce exactly the results we see. Yeah. If we don't like the results, we have to change our systems.
Yeah.
And I think that's what we're hoping we're all here to do, is to challenge those systems that aren't working, that are failing people. And that this public health crisis is only just highlighting, I think, what many of us knew existed already, in terms of the need for systems change. Iain, I think you really hammered home the point that housing is healthcare, period. If we want to address health, if we want to address this COVID-19 environment, housing is the answer. And we have to reorient our systems to be housing centered and focused. Thank you for bringing that message home to us and reinforcing that message here as we continue to re-examine our systems. Thank you for leaving us with some challenging questions and calls to action. And I just want to thank you for bringing your passion.
I couldn't think of a better way to spend my lunch hour on a day like today, and the opportunity to engage with the community that, you know, we're new friends. Let's go forth, appreciating that it's our responsibility to make change happen. And rather than running away from that, let's embrace it. We can end homelessness. We manufactured it. We can end it. Thank you. Be well, everybody. Bye for now.
Thanks so much, Iain. Everyone, thank you for spending your lunch hour with us today. And thank you to all of you who are out there every day advocating, pushing, and pursuing social justice to create systems that work for people. We hope to see all of you again on October 20th for our next series on housing, homelessness, and racial equity, or in honesty, racial inequity. And hope you can join us for that discussion. We'll have a phenomenal panel to engage issues around race, housing, and homelessness. Thank you all. Continue on together, and hopefully we have found a great new friend in Iain, and we'll continue the conversation. Have a good rest of your week.